Greetings from Southern California, USA. My name is Dr. Emily Letran. I am the host of the webinar today for the Global Summits Institute. At the Global Summits Institute, we want to provide you with best resources, practice strategies to help you grow your business, not only just clinically, but also in the business sense. And that is why we have recently launched our new program that will be starting in 2022, and it's the Doctor of Business Administration with emphasis in healthcare. This program has three different tracks. It emphasizes on finance, your personal finance, debt management, all the way up to investment. It focuses on business administration, marketing, team building, personal growth, um, how to be a leader in the community, how to attract more patients to your office. And then it focuses also on research. With the research, you can design and finish a research project, present your thesis, and that would give you an edge in the future, in the near future, if you want to go and teach at a university, or maybe you're collaborating with a company, that you can come in as a consultant. So we're really, really proud of that. I'm very proud to be the appointed dean of the program. And I invite you to come and join, take a look at it, join us. We also offer scholarships. Go to drhb.com. So the whole word doctor, hb.com. And this morning, it is my absolute honor to welcome Dr. Felix Liao onto our partner. Dr. Liao is a thought leader and healthcare innovator. Uh, he has 3 best-selling books on impaired mouth syndrome, and he addresses a wide range of medical, dental, mood symptoms rooted in poor mouth structures and usage. And one of his books, which is very well known, and a lot of my colleagues always rave about it, is the one called 6-Foot Tiger, 3-Foot Cage. I'm sure he's gonna talk about that a little bit. His insights and expertise in the teaching has made him the father of airway mouth doctor, and it's a growing new breed of dentists focusing on oral contributions to airway, obstruction, sleep apnea, snoring, teeth grinding, chronic pain, fatigue, and more. And as the director of AMD training, Dr. Liao's mission is to help dentists upgrade their dental patients' overall health by mouth, and to help all healthcare professionals grow new eyes to see the impaired mouth syndrome. And I had a chance to chat with Dr. Liao uh, a couple of months back, and it's so, in this day and age where everybody's doing the same thing, right? Everybody's taking insurance. Everyone jumps on the bandwagon and do very similar thing like aligners, clear aligners, or the cosmetic dentistry, which could range just from whitening all the way to full mouth rehab. I think airway is still a very much unexplored territory, and it's a great way to help grow your practice and position yourself as somebody totally different in the community. And on top of that, you can collaborate with other healthcare professionals. So making you the true mouth doctor, right? As Dr. Liao like to call it. Dr. Liao, good morning and welcome to our partner.
It's a delight and a pleasure and an honor to join you, Dr. Emily. This is a fabulous program and a fantastic futuristic concept to empower dentists and other healthcare professionals. So thank you.
You're welcome. And yes, and I appreciate you coming on. I know you have just finished your traveling. You have just come from another conference, and there's nothing like showing up, right, and doing what you love, because people can. It's very easy to put on 10 posts on Facebook or LinkedIn or talk about it to somebody, but when somebody takes the time to travel and to show up, not only that, it's an investment in time, it's an investment financially and sometimes emotionally, right? Yes. Especially if you get stuck in the airport or something. And so I have a lot of respect for those who come on, and I know that they have, gone through that journey, and it's because they want to fulfill that calling. So tell me a little bit. You're a dentist, and at what point in your career did you it's kind of get you started to think that you should look at things in the bigger picture more than just the 28 or 32 teeth?
Wonderful question. So everybody has his or her own story. I got to dental school by way of an engineering degree out of Ivy League College. And I found myself, I'm an immigrant from Taiwan. I came to US when I was 16. And 2 years later, I was at Brown University where all my classmates could write a term paper overnight and get an A. And I couldn't read, 100 pages in a week's time, even if I carry my dictionary everywhere I went. But I could do the math, and I did graduate with an engineering degree, and I did get to dental school with an engineer's mind. And one of the things that interested me was not only anatomy and physiology, but also teeth grinding. I mean, why would the body destroy the hardest tissue it has? It never made sense to me, whatever the explanation was given to me by my dental school professors. And night guard, I mean, to me, it's just, to my engineer's mind, it's just nonsense, right? You're just sticking something in between so that you can wear that away. So it began a 35-year professional quest. This question just never stopped nagging at me, okay? And of course, you see it enough in your practice, in your patient, in myself. I used to hear my sons grinding his teeth across down the hallway. And I felt powerless as a dad. I was a car-carrying general dentist, AGD, ADA, you name it. I was a member doing everything else that was new and supposedly better. But teeth grinding just never got answered for my engineer's mind. Well, I was a seeker and was always on the quest, taking courses here, there, everywhere. I not only took courses in dentistry, I took courses in cranial osteopathy, in nutrition, in acupuncture, in chiropractics, chirodontics, you name it. I pretty much did it all. Nothing made sense until I got to PMJ orthodontics. I saw that after the disc was recaptured, there's a posterior open bite. Universally, there's a posterior open bite. And then I saw the mandibular advancement devices for airway, and they all, well, not all of them, often end up with a posterior open bite. I'm saying, we're close, but not close enough. And then I met Dr. Dave Singh, who introduced epigenetic orthodontics for adults. And boom, the last of the piece of the puzzle came into place. Because teeth grinding, just give you a one-line summary after a 35 years quest, is one frame in the movie. The movie is not called dentistry. The movie is called airway obstruction during sleep. And teeth are just victims of a roadkill. This roadkill or this victim is really the result of the body's struggle to stay alive. And the teeth just got in the way. So I'm gonna just mow you down and get you out of the way so I can get my oxygen to my brain and to my heart so you can stay alive, okay? So it's survival. It's self-administered resuscitation. Right? And there are lots of studies along the way that connected the dots, which we talk about in my AMD training, but AMD, by the way, stands for airway mouth doctors. And I truly believe that dentists have an opportunity to expand their services to take care of more of their patients who are on recall, don't have any more cavities, because we've done a great job. They don't have bleeding gums, so they've done a great job. And so what else is there? Well, I'm gonna tell you another one-line conclusion. Every dental office has an airway practice built in, okay? This airway practice is rich enough that you can walk away from drill and fill hamster wheel. So I am totally juiced by this prospect and journey. I say journey because I personally stopped doing general dentistry about 3 years ago. It felt so good when I said to my office manager, hey, when we run out of this composite, don't reorder it anymore. You know how that feels like, right?
Well, you know,
Yeah.
I love it that you speak about airway in such a colorful way, right? Because
Well, it's
you're
true.
drawing. You know, I know, but there are different people who talk about airway differently. Because I've gone through several, different airway training, and the fact that you put it as a picture, right? It always helped because sometimes and I think it helps also, and I'm sure you use it with the patients, right? Because it
Yeah,
draw that picture
absolutely.
for them rather than saying, you have this hole in your tooth, right? If
Yeah.
you draw a better picture, and all of that is a presentation skill, and I don't want to call it a sales skill, but it is a sales skill, and the mindset that how do you convey this to the audience, right? Whether it's to the doctors or to the patients. And I'm glad that you come into dentistry with an engineering mind. We had a doctor earlier. I was interviewing a doctor earlier this morning, and he came in with this total business mind. So he looks at everything from a business way, and he innovates certain ways to run your practice where you can alleviate the stress and you can still have the control of your practice. So yeah, and I love your journey, and the fact that there's no choice, right? 3 years ago you say there's no more drill and fill, and we're gonna take
It
it this way. So
is rich.
why don't you start on your presentation and you show us your insights and your expertise on airway.
Okay, thank you for the
You're
opportunity.
welcome.
I'm glad to. And I would just have to warn you, this is a um, um, probably a 3 hour seminar condensed into 45 minutes. So just, strap yourself in and get ready for a um, fast bus tour, drive by, okay? All right, so let's go here. Can you see my screen okay?
Right now, I'm just seeing, I don't see your PowerPoint yet. It just looked black.
Huh, interesting. Okay, let me see. We checked this out earlier. It was fine. Okay, let's see. It's just black, huh? Okay.
Yeah, I'm not seeing any picture yet.
All right. Let's do this then. How about now?
Still black.
Okay.
Well, let me check. Maybe it's me.
Here we go.
Let me-
Here we go. There
oh,
we
there you
go.
go. There you go. Okay.
Okay. Well, so here we go. I'm
You,
gonna base what I do on. Go ahead.
yeah, you want to make it full screen, doctor? Because I can see the slides on the left side, or is this how you want it?
Yeah, this is how I prefer to present it.
Okay. Okay.
Yeah. All right. Just focus in the middle part because at some point I'm gonna need to decide which slide to skip in the amount of time that we have. So what I do is based on what U.S. Surgeon General said in his report, Oral Health America, way back in the year 2000. So we're 2,000 years behind. And that is oral health is more than healthy teeth. So one nice introduction. What I call impaired mouth syndrome is responsible for many medical symptoms on the one hand and dental symptoms on the other. So an impaired mouth syndrome is something I'm going to explain shortly. Okay, so just bear with me that dentists, when they become airway mouth doctors, has lots to do. we have many patients in our practice who have straight white teeth and clean gums, but totally miserable patients. Okay, they're miserable owners of these teeth. And from our standpoint, we did our job as dentists, tooth doctors, I call them. But if you look carefully, here the midlines, upper and lower, are off. This is a recipe for disaster, like pain. And sure enough, these patients all suffer more. And it's aggravated by bicuspid extractions. And every practice has patients like this that are just waiting for somebody to rescue them. Okay, so a little bit about myself. I have a 3-part series. Those of you who are interested could reach out to me and we'll be happy to share all 3 parts with you. I choose second part because all dentists have aches and pains. So taking this bus tour will help you to see how you can help yourself. All right. So AMD training, like I said, AMD stands for Airway Mouth Doctors, turn smile doctors into wellness doctors. Okay. And we don't just turn out appliance technicians. We turn out real mouth doctors who's in charge of the airway. Okay. Here is the upper airway. The air enters the nose. This is zone 1, nasal cavity, goes behind the soft palate, behind the tongue before it enters the trachea, which is zone 5. Zone 4 is the oral cavity that we look into when the patient opens the mouth for hygiene checks, all right? But in here, okay, we actually are simultaneously the upper airway diagnostician, we are the craniofacial architect, and we're a whole health integrator. I'm going to explain every one of those to you very shortly. And so, aches and pains. Anybody who does not have aches and pains? All right, so this is almost like the curse of, being in this world, like Buddha says, right? Well, there is a reason why, and we can make this go away very predictably as mouth doctors. You understand how the mouth fits into whole body health, all right? So AMD diagnose and treat oral contributions to all of the following. And I'm going to just focus on aches and pains and a little bit about teeth grinding. I want to just say that, dental implants is the new rage. I just want to warn you that dental implants fail at 3.3 times at the rate of in bruxers compared to non-bruxers. So alignment, breathing, circulation must come before you do dental implants. Otherwise, when implants fail, what is your recourse? Just think about that, all right? So AMDs, by treating the airway, could also affect all of these other conditions. And now you can see, by looking at your patient's medical history, that their medical symptoms are often rooted in an impaired mouth structure. So let me explain that to you. So the mouth is, to humans, what roots are to plants. You got a misaligned and rotten mouth, you're gonna have rotten health. If your mouth has what it needs, then it will thrive. If your body has what it needs, it will also thrive. And how the body thrives comes from the mouth. And so I define a holistic mouth as one that is structurally fit and sensibly used. Okay, so one is structure, one is usage to support whole body health with alignment, breathing, circulation, digestion, energy, and sleep. So when the body has this, it will thrive. But if it does not, what happens? You end up with what I call impaired mouth syndrome, okay? An impaired mouth is a defective infrastructure that can eat, drink, and talk, but it cannot support alignment, breathing, circulation, energy, digestion, and sleep. And therefore, they will contribute to a lower quality of life, including all of these. And I listen because I've had reversals on every one of these symptoms among my patients who started treatment. So if you can sleep better, you'll be less irritable. If you have more energy, your body can run itself. Okay. So who does not have neck and shoulder pain? And this is called trigger point. Trigger point means that the origin is here, but the symptom shows up someplace distant. All right. So very often the temporalis, the masseters, and the molar pains are rooted in the head posture. And dentists often forget, so do their patients, so do medical doctors, that maxilla and mandible is part of the head. This is how important it is. The only way we can resist gravity, which never stops putting us down toward the grave, by the way, is with a level and square structure. This level includes the occlusal plane. When you don't have level occlusal plane, the rest of the body has to compensate. And so you'll have aches and pains and you'll have dental problems, okay? And the only way back is by doing this, which, as I say, must include level occlusal plane, right here. So here's my point. Every mouth owner needs a mouth doctor. The reason why US has so much healthcare trouble is precisely because the owners don't have any guidance from any doctor. We have a specialist for every part of the human body except the mouth. Have you ever been to a hospital with the department of the mouth? Well, that's where all the problem comes in, okay? That's why I write a book called A Mouth Owner GPS to Vibrant Health and Innate Immunity. Because you have to give the body what it needs in order to thrive. And if it doesn't, it's gonna crash. So let's look at this. Here's a good airway, and you can see the good airway on the inside by this color scale. The more on the white end, it means wide open 6-lane highway. The more you go toward the red and off the scale black, it is like angel hair pasta for airway, okay? So you can see from the outside and forecast on the inside what it's gonna be looking like. So I call this the Liao sign. I see so many of this upper lip in profile that drops straight down, or worse yet, it's curled, okay? Whenever you see this, you can expect that there's gonna be airway trouble further back in the back of the tongue and the soft palate. It's a real life patient, okay? That's her tongue, that's her airway. And teeth grinding. Well, I have news for you. This is how I got into teeth grinding, and I've polled enough dentists who've taken my training that teeth grinding is present in 80 to 90% of all the dental patients that come to all dental offices. Okay? That represents a tremendous opportunity for you in terms of airway practice, because teeth grinding is just one frame in a movie. This is my one-line conclusion from 35 years quest, coming into dentistry as an engineer. The movie is called Airway Obstruction During Sleep. The movie is not called Centric Relations, all right? So the body is trying to resuscitate itself in an effort to open up the airway during sleep. How do you resuscitate? Or do CPR? You tilt the head back and you advance the mandible, right? What's the mandible doing here? Well, every general dentist office has easily 30 cases a week on this. I've done the math for you, okay? 80% of 40 patients a week is 32, all right? And teeth grinders don't just have teeth problems. They have all these others. Take a few seconds and take an inventory of yourself. See how many of these you too suffer from. And once you open up the airway, all of these start to get better. You may have other issues. And your patients may have other issues, okay? But it all starts with airway and sleep. And it turns out that the mouth really matters. The jaw really matters in airway and sleep. So speaking of aches and pains, hold the phone up to your eyes. Don't drop your head to your phone, because that's the source of pain. Okay, the trapezius will refer to the temples, the zygoma, and the angle of the mandible. This is your masseter muscle. This is your temporalis muscle. Muscles of mastication. Well, you have a persistent upper teeth sensitivity, look to temporalis. Okay. And trigger points origin is from teeth grinding and or narrow airway. How does this patient get here? Well, we know that she had bicuspid extraction, courtesy of the orthodontist. And how did she lose the rest of the molars? Well, most likely it's from teeth grinding and jaw clenching to compensate for this narrow airway. Okay. Minimal cross-sectional area in this case is 92 when it should be about 400. So this patient has been running out by oxygen deficit for a long, long, long time. Okay. Masseters. Uppers, molars, and lower molars are the referred target of masseter trigger points. How do you think this patient lost his tooth? Because the dentists are just two doctors and they don't see the mouth connection to the rest of the body. Here's a study out of Kyoto University Medical School, okay? They did 3 beagles. I took the occlusal plane out of contact on the right side under general anesthesia. When the dog woke up, they become lame on the contralateral side. I saw that research and I asked myself, how many of these patients do I have in my practice? I started looking and they're everywhere. And the patient says, what? You can help my lower back with what you do in the mouth? Yes. And because of time, I'm not gonna play his video, but he says, he calls this my healthcare home run, okay? We only gave him an upper appliance. No mandibular advancement here, okay? All right, so Scm muscles, it turns the head and start paying attention. You got cosmetic dentist fine eyes. Look at this muscle, way bigger than this side. That means what? The patient's head is turned to the contralateral side. Okay, so this muscle here is bigger when I turn to my left. Okay, so she's chronically turned one way, in this case, to her right. And she has all these symptoms. And she had bicuspid extractions. And her midlines are off. And she had fatigue. She wake up feeling refreshed only once a week. Okay, she's got tongue tie. Nobody ever diagnosed these things for her, okay? Poor thing kept suffering. Same thing here. Bad back contributes to hip pain. Yes. How do we know? Because she texted me. Hip, hip, hooray. 0 aches last night. Before that, she could only sleep in 2-hour chunks. How did we get there? Well, we did our homework. I came up with this method called 3D Jaw Diagnostics so that each AMD can figure out what's off where and how much in order to treat the patient. And we have oral appliances that will solve these kind of problems. And they get better. Pain and fatigue goes down 70% in 2 days. Again, we don't have time to listen to the entire video. But this thing works and it works fast as soon as the airway is opened up. So this is my main message. An airway mouth doctor belongs on the top of the totem pole. Okay. Paul Chek wrote an article. He's a chiropractic neurologist. wrote an article in 1993 called The Totem Pole Hierarchy of Survival Reflexes. Number 1, breathing. Number 2, eating. And number 6, digestion. Number 8, hunting and gathering. The mouth participates in at least 4 of the top 8. That's what, and guess where the top of the totem pole shows? The mouth and the jaws. So we show and teach how to assess whole body health by looking at the mouth. And what you need to understand that we never learned in dental school is that maxilla should work like a shoe. Therefore, it needs to be bigger so that the mandible can fit in. Okay. And so whenever that's not the case, there's going to be a problem. And guess what? We're going to show that the maxilla is much or a little bit smaller, and that's going to create a problem for the patient. This is a scoliosis patient. Okay? This is our arch. No dental problems, except for one cavity. Okay. Now, I look at this, and if you take the training, you'll grow the eyes to see why this patient would have pain. Look at her midline. Her midlines are off. Okay. Her lower anteriors are bent lingually. Okay. That means the mandible is too big for the maxilla. In order to fit in, the teeth are going to have to twist themselves, cramp themselves. That's her posture. We assess the patient head to feet. Her left foot is pronated. That's why she stands like this. Okay. So her neck is like this because her jaw is like this. At least there's an oral contribution to it. I don't treat scoliosis. I treat oral contribution to scoliosis. I do not treat sleep apnea. I treat oral contribution to sleep apnea. But guess what? If you don't identify and therefore treat oral contributions, the patient never get completely better. Why? Because, well, is the hip bone connected to the thigh bone? So why aren't the jaw bones connected to the rest of the postural chain? And most frequently, because of the medical dental divide, the dentists never get invited to participate in medical care when there is an intimate connection. And so here's a patient who basically, I'll just play a little bit of this.
Hi, my name is Martha, and I give permission to record this.
Thank you. So you've had this for 2 weeks now, right?
Correct.
And tell us what wearing this appliance has done for you.
It's a lot easier to walk now. I have a less lisp when I wear it.
Oh, you're wearing the appliance right now, right? Sure.
Yeah.
Smile as big as you can. Right, good. Okay. Now take the appliance off for us, please. And you show it to the camera what it looks like. Okay. So this is called the Dr. Liao Start Thriving Appliance. Okay, go ahead and put that down and tell us what it's done for you, please.
As I said, it's a lot easier to walk.
Really?
I used to limp a lot when I walk, but now I don't.
And you have a medical diagnosis of?
I have a medical diagnosis of scoliosis.
I see.
And this has improved my back curve a lot and my posture, which helps it every day.
Wow, and you've been wearing this thing for how long?
I've been wearing it for 2 weeks and it's been working great.
Wow, really? Thank you for sharing your experience with.
Of course.
It is from. Okay, so we learn from cases like that as doctors, okay? So what we need to realize is that the 4 upper front teeth and the bone around it called premaxilla arise from the same neural tube cells that ends up forming the central nervous system, including the brain, the spinal cord, and the pituitary. The rest, okay, of the dental system forms the peripheral nervous system along with the rest of the hormonal glands and the proprioceptors and other sensory receptors. So you can see that the maxilla and the mandible belongs in the body's command and control center. I claim that we have 5 limbs. We can live without the other 4, but not without this one. Okay? So energy is everybody's what? Search. Why do we drink coffee in the morning? Why do people reach for dark chocolate and cola joints at 5-hour energy? Okay, I'll just tell you that this works straight from her mouth, not mine.
Okay, hi, I'm Kimberly Small and I give Dr. Liao permission to use this for training purposes. I wanted to talk about how much more energy I have now after this treatment. I used to come home from school. I'm a special education teacher. I would collapse on the floor. Well, it was a planned collapse for about 10 to 15 minutes where I would have to recharge my energy in order to continue with my day because I was so exhausted. And now I don't need to do that anymore. In fact, I've taken on a new training in addition to my work. So now I'm becoming a Pilates teacher too.
Wow, congratulations.
Thank you.
Thank you.
Yes, it's wonderful to have more energy.
Yeah. You've been a great patient. Thank you for sharing your experience with us.
Thank you.
So energy is the difference between death and alive. It's the energy between thriving and crashing. It's the difference between feeling well and feeling ill. Look at these two. They're twins. One had bicuspid extraction, one did not. Ladies, which face would you rather have? Guys, which one would you rather take to the prom? All right. It's okay to be skeptical, but it's important to also keep an open mind for new things to come in. You know, a lot of people like to mouth off and say, oh, that's not possible because I believe in this and not that. Well, I would say to you, get trained, get informed before you give your opinion. Right? Speak from knowing. So here's what we know. The orbit forms part of the floor, the maxilla's rooftop is the floor of the orbit. So this is why Dr. Singh says, when you can see the white sclera between the iris, the colorful part of the eye and the lower eyelid, then it's a sign of underdeveloped maxilla. All right, this is what mouth doctors do. We play CSI, chairside investigations, and we look for clues. Okay, so how do we take this young lady from here to here to here? And this is not photoshopping. Okay, this is baseline 8 months and 40 months. No night guards. Okay, here's what happened. She came in having ground through her night guard. Her mother's chiropractor sent her to me. This is 3 years after braces. Ended up with an anterior open bite. If you give her another night guard, could you get results like this? This is what epigenetics means. You can redevelop somebody after their growth years. Where the anterior open bite comes from? You got to treat the root cause. What's driving this tree to bend this way? So we do our homework. We gave them the appropriate treatment. We talked to them about nutrition. How do you eat to complement your oral appliance treatment? That's never been done in the history of dentistry. We're trying to grow jaws, and you need to give body a bone building diet. Well, when the patient is compliant, you can end up with a very different looking face. She disappeared for a while and then showed up, and I said, wow, do I recognize this gal? And her anterior open bite closed spontaneously. Once you expand the maxilla, mandible follows, the tongue doesn't have to get stuck in the throat. How do we know? We have CT evidence to show that we triple her airway. And this is her posture. You can see that all the postural planes are correct. She got recruited to be a part-time model. and the science of stem cell activation using epigenetic oral appliance is all listed in chapter 16 of my first book, 6-Foot Tiger, 3-Foot Cage. And if it works for a 16-year-old, would it work for a 67-year-old? This is a retired librarian. Look at her lips, pre-treatment. Look at her lips after treatment. Okay, so we bring out a better version of everybody, cranial, facially, and because the skeleton is well developed, the soft tissue looks better. Somebody who just came off braces and say, oh my God, is it too late? No, we have ways to do this. This is called a wraparound appliance. Okay, and this keeps the spaces from opening up, so the orthodontics is not wasted. So here's pre-treatment, here's post-treatment. So the critics often, or skeptics would say, oh, all you're doing is just pushing the upper posterior teeth out buccally. You're not really expanding the jaw and growing the jawbone. Well, I ask you to look closely in this zoom-in view. Any posterior flaring? How about here? How about here? How about here? No, we don't see that, okay? And the reason in part is because we put our patients on a bone-building diet. Here's green smoothie, the best of the plant kingdom, and here's bone broth, the best of the animal kingdom. So all you general dentists, start paying attention to these points in blue here. Okay, the bullet points in blue, you have many, many of these cases. Then once you start offering airway diagnosis and treatment using epigenetic oral appliance to redevelop jaws that fail to thrive during developmental years, you have a brand new practice. Enough for you to get off the drill and fill hamster wheel. So one of the first things I say to my AMDs who start training is start looking for an associate to take over your general dentistry. Now, how does that make you feel, right? You feel relief, you feel joy, you say, what, really? Yes, I have AMDs who have finished training who are saying, I should have done what you said. I wish I had an associate to take over now so I can do this full time, okay? So here's a young man in his mid-40s came to me with hip pain. You have to know how to learn to speak to your dental patients so that they will tell you what really bothers them. What bothers this guy is obesity, okay? Snoring since age 7, he's 160 pounds overweight, pain, depression, fatigue, low drive. It hurts his self-esteem to look and feel this way. So my question to myself is, if I change his amalgams, would that improve his self-esteem? If I cap all his teeth, would that improve his self-esteem? No. What can I do? I can identify that he had a 8-foot tiger in a 2-foot cage. All right. That's because I know how to do this homework. And look at these numbers. Huge deficiency. And his airway is in the, he has no right to be alive. Okay. His airway is in the black zone. For some guy this big and this overweight, he needs a much bigger airway. All right. So we know his vertical is squashed and his AP is scrunched. So he has big time in Paramount Syndrome. And when you go to bed night after night with an airway like this, it's like confronting death. Week after week, year after year. I mean, you can practically hear the scream of this poor animal its moment before its lunch for this fox in the Tibetan mountains. Okay? This is an adrenaline surge to the max. And that's what happens when patients with sleep apnea go to sleep. Their body is screaming. So when we're young, so this is cortisol level, and this is wellness, and this is illness, total collapse, okay? And so here you have self-regulation. When you're in college, you can go and party, and next day you hardly miss a beat, okay? Once you get through dental school, pass the boards, start a practice, start a family, the stress keeps up and your body starts to run out of this ability to self-regulate, okay? So I often ask the patient, tell me where you think you are on this downhill slide. And if you're in this zone halfway down the downhill, how can you recover with a poor airway and an empty tank? So we talk about all of this, and this is what really cares, what the patient cares about, okay? We talk about this in this latest book that I wrote because I got tired of having to explain the same thing to the patient day after day. So I say, I'll put it down on paper and you can go read about it. But here, white is airway, green is food, the mouth usage. So white is mouth structure, and two, which they can't do anything about unless you help them. And two is diet, okay, which they need you to guide them. So if it works, they'll thrive. If it does not work, they will crash. It's that simple. All right. So what did we do? What happened to that young man? You can see that he's starting to look more vibrant. I joked to him and I said, you look like the adult version of a Gerber baby. All right. So anyway, you'll see this in video if you're interested by reaching out to me. I'll send you the full thing. You can play it. Right now, I'm not going to play the video testimonial so that I can finish on time. All right. So no appliance ever fix the patient by itself. It takes a real doctor. Okay. A doctor who knows this, a doctor who knows that obesity at any age increase the risk of severe illness from COVID. A doctor who knows that appropriate weight management is important in the treatment of adult obstructive sleep apnea. It's never, ever just the appliance. Okay? So you can put this together and help the patient proactively. This is the best part I love about being a dentist. Prevention is built into our professional DNA. We have dental hygienists. We have effected the most impressive paradigm shift in healthcare, which is loss of teeth, denture by 50, to now you don't expect to lose a tooth. So long as you don't brush and clench because of airway problems. Okay? And because the mouth is the root of illness or wellness, we get to play the most pivotal role in whole body health. We control the first domino. We get to keep it standing strong. Okay, so if you go to ICU, they give you what? A ventilator, nasal cannula for oxygen, and they give you an IV for what? Nutrition. Well, we can do the same thing at home, in their own bed, in their own kitchen. So, in this way, we get to help the patient head off their health catastrophe. I don't know about you. I like to go to bat for my patient, hit a home run for them. I like to help them win. That to me is fulfilling spiritually, emotionally, okay? And you get paid with not only fees that's appropriate for this level of contribution, you also get paid with emotional capital and patients want to buy solutions. They don't want to buy drill. They don't want to buy shots. They want to pay you for get them well. And you get to solve all these problems for them by working with the mouth. Identify this impairment that's blocking their health quest. We can raise beautiful children by identifying chapped lips, lack of lip seal, craniofacial asymmetry, teeth grinding, finger sucking. And how does a patient end up with habitual mouth breathing and chapped lips and lip incompetence? It's because they have nasal obstruction. And the poor mothers never get any guidance. Instead, you can raise beautiful children like this. This mother is already nutritionally aware and doing the right thing. And she says she still does not look right. And look what we're able to do with the help of the epigenetic principles. Bone building diet and nasal breathing. So I invite you to look this up. It's called Paramount Syndrome score. You can go to holisticmouthsolutions.com and you can download this for free. Give it to your patients for 1 month. Have all the new and recall patients fill that out. And you'll be convinced that you have a airway practice built into your dental practice. So in closing, I just want to reemphasize that an airway mouth doctor's role is on the top of the healthcare totem pole, okay? And one of the dentists in training, Dr. Brian McLaughlin said, percentage of dental patient needing an AMD, 80 to 90%. Advice to fellow dentists. This is eye-opening stuff and so overlooked by the dental profession. We're in the perfect position to help people out because we're working in the entry point of everything that is needed to live, and I might add, thrive. So with that, I will close my presentation and thank Dr. Emily for this opportunity to present to you a new possibility of engaging your patients, of serving as their rescuers for the chronic, degenerative, and painful disease and suffering. Thank you, Dr. Emily.
Well, thank you so much, Dr. Liao. I think maybe we can close the share screen.
Okay, sure.
Yes. And there's a lot of comments on the Facebook group that this is such a fascinating topic, and I think, and that's why I love your drive and your mission. Is because even though it's not new, right? I think the first time I took a course on airway was probably at least 10 years ago, and even though it's not new, I don't think we've done a good enough job educating the public, right? And I'm glad you have the books out, educating the public so then the public would know they basically self-diagnose, right? And then they would,
Yes.
and then they can go and they can look for those of us who want to offer that solution because, and I think the awareness needs to be raised. And that's why we're doing these partners, because the more of our colleagues are, whether they didn't know or they get reminded that this is a big opportunity, they should look at it that way first, right? To actually serve your patients to the best of your ability, right?
Absolutely. Just
Yeah.
think about how many dentists around you do cosmetic dentistry and implant dentistry, and ask how many dentists in a 100-mile radius do airway mouth doctors work.
Right.
And you have no competition. None.
Right. Yes. So, and I know you have workshops and everything, and I know you put on the, your contact information. Thank you for that.
Yeah,
If somebody, let's say they say, and I understood you say, okay, I should have an associate to take over my general part of the practice, and then maybe I can focus on airway. What do you think? What percentage of doctor that you know that maybe the whole practice become an airway practice, including the associate?
Oh, we're seeing that every month, at least one practice started to take over. I mean, you start giving that in Paramount Syndrome score, and the patients, what? I got this. What do I do now? And you help them connect the dots. You start a whole new airway practice out of your general practice. And that is something that requires staff buy-in. So we train the staff without additional charge. Like our training includes staff involvement. So when the doctor sees fit to do that, their practice always takes off with strong tailwind because of the staff empowerment. And so we see that every month, doctors will say, yeah, you're right. This is happening. This is happening. I can't believe it, but it's happening. I
Yes.
had one dentist who produced $33,000 in 1 month, and 25,000 was from airway work.
Mhm. So,
The producer, you can do so much a day.
right. So, and I don't mean to simplify your process, but would you say that a lot of airway, and this is just for, our colleagues, would you say a lot of airway is going to be gathering data and the diagnosis? And then,
Absolutely.
right?
Yes.
And then
Start there. Yeah.
the delivery is the appliance, or maybe there's some follow-up ortho, but the majority of the work will be systematized and diagnosed and planned out
Absolutely.
with your
And your
diagnosis.
staff
right?
can do a lot of that for you. Your staff
Okay.
can do a lot of that for you. And you're just going like the hygiene checks. Yeah. The hygienist has pre-educated patient and presented a case where you already just say, yeah, Jenny is right. Do what she says, you'll be better shape.
Right. And I don't know if you know, but the Global Summits Institute, so we launched the Doctor of Business Administration, teaching doctors how to do business with the emphasis in healthcare. Our next project would be to actually open our own professional schools. And
Yeah,
and what I can see is possibly inviting you in to we're just going to start a whole department of airway dentistry, because these
I
are the
love to
things
participate.
that the doctors need to learn, but according to the dental school, there's no time, right? It just like there's no time to teach you business. So now we have this doctor business admin program just to help the doctors do that. But with a new dental school, what I would do is I would take out a lot of the basic science classes that like histology, where we're not going to spend a whole quarter. Maybe we just do one, a couple of lectures. And I tell my friend, because I asked them the other day, I say, when was the last time you guys look at a slide? And they all look at me like I'm crazy, right? Because we've been out since 93, so 28 years. And I said, so, but I know it was a whole course because I have the book. I have the histology book. That means that we spent a whole quarter on that, and we will never look at a slide again. So replacing those with things like airway, replacing those with things like business, business system, marketing, those kind of things that are actually more practical. And maybe you're not going to be tested on the board, but who cares, right? Because
you're gonna be tested in real life every day on how you manage your practice. Yeah.
Exactly, or how you're different from the other doctors. And I know for a fact, you treat that snoring patient, you're going to save marriages, right? That's a very common thing that we hear patients say. So thank you so much for coming on and sharing your expertise. And
Thank you for the invitation. I
oh,
totally enjoyed it.
great. And I apologize because we're not meant to do a whole workshop, and I can see that you have a lot of resources there. The doctors who want to know more, they can comment on this Facebook page, and we can reach out to them. You gave your contact information; they can reach out directly to you.
Yeah,
and
absolutely.
we are in this to change the world, right? To make
Absolutely.
it
Thank
better
you for
our
your
patients.
mission and your heart. Yeah.
Yeah. Thank you, doctor. So
Okay.
thank you everyone for joining us again on this partner on this particular Sunday, or maybe it's Monday where you're at. We really appreciate you spending the time with us. We hope you take some of these insights, apply in your business, in your practice. If you have any questions, reach out to us, and make sure you check you check out our brand new program, drhb.com, where we will be helping you grow your business by giving you more business insights and systems to be successful in all aspects of your life. Thank you so much.
Thank you.